So you got exposed to COVID-19 patient. Now what? This is the video about that. So this is you, and you go around doing the things that you do every day, of course practicing social distance and trying to be as cautious as possible. And then you find out that you were exposed to a COVID-19 person. And there might have been an exchange of virus there depending on how much protection you were using versus how much protection the other person was using. For example, did you both have masks on? Were you doing frequent hand washing? Were you maintaining the social distance? So all these criteria will decide whether you did get infected or not. So best case scenario is that you did not get infected and your test is negative. But that still means that you have to quarantine for 14 days. And the reason for that is 14 days is the time period during which symptoms in most of the patients develop. So it's usually between anywhere 2 to 11 days, but 14 days is considered to cover about 99% of the patients. The other chance is that you did get infected. And if you did get infected, you would test positive for COVID, or you develop symptoms. So there's a good chance that you would have no symptoms, and that chance is about 30 to 40%. Also, 1 out of every 3 people would have no symptoms at all. Does that mean it's good? It's good, but for you, but not for other people, because you are still contagious or infectious to other people. You may be shedding the virus, and that's the reason a quarantine for 10 days minimum since the day of your COVID test positive or from the day of exposure to a COVID positive person, whichever is longer, is what you need to quarantine for. Now, if you did not get tested, the day you were informed, 14 days from that day, you would need to stay in quarantine. Now, most of the COVID-19 symptoms, the coronavirus symptoms, develop within 2 to 11 days. According to data that's coming from New York City and China, most of the people would develop their symptoms within 4 to 5 days. So once 1 week is over, the chance that you're going to get symptoms is reduced by 50%, but still there is a chance that you will develop symptoms, and that chance would stay up to 14 days. So hopefully you will develop only mild symptoms, and mild symptoms are scratchy throat, some malaise, body aches, loss of smell, loss of taste, a mild cough, maybe some burning in the eyes or allergy like symptoms, or maybe runny nose, which is very rare in COVID, but that can happen too. Some of these patients would progress to what we call as moderate symptoms. Moderate symptoms include high-grade fever. That means the temperature is above 100.4. There's increase in cough. There's nausea. There's severe malaise. So those are moderate symptoms. 1 out of 3 people on approximately would develop moderate or mild symptoms. And out of which 14% of the people, that is 1 out of 7, would develop severe symptoms. Severe symptoms include shortness of breath, low oxygen level, nausea, vomiting, diarrhea, seizures, stroke-like symptoms, confusion. So these are severe symptoms. All the patients with these symptoms need to be hospitalized or monitored in the hospital at least for a short term to make sure they are stable before they can be released to home. So if you do develop these symptoms, you definitely have to contact your doctor. The best thing to do is contact your doctor once you know you have been exposed to a coronavirus patient, so that you can be in touch with your doctor and update them about your symptoms, and then they can give you guidance on what to do next. Now, 5% of the people progress to critical state, in which they do have severe shortness of breath, that they cannot breathe by themselves, so they have to be put on ventilators. And these are the patients who are critical. Other critical patients are who are developing gangrene of the legs because of blood clots. As we discussed in our previous video, blood clots is a very common feature of COVID-19, especially in patients who are having moderate to severe symptoms. So critical patients are very high risk patients, because if you look at the mortality rate, about 60% of these patients, so more than half of these patients, would not live through coronavirus infection. And that is what makes coronavirus very dangerous, is you do not want to be among these 5% of the people, because most of the deaths with coronavirus are reported in these 5% or critical patient or critically ill patients. So there are 3 easy things that you can do, and this is just a reminder. I'm sure everybody knows about it. One is wear a mask, keep social distance from other people, and wash your hands frequently. Do not use gloves. Wash your hands frequently. And this is me, and you see what I'm wearing. And now see, wearing mask is so easy. Keeping social distance is so easy. Washing hands frequently is so easy. This is what we healthcare workers are wearing. So trust me, wearing a mask is so much easier than doing this. Thank you for watching the video. Support us by liking this video and sharing this video, and subscribe to our channel, and we will be posting more updates as soon as possible.